We'll be going over how to set up a surgical tray for an excision. The first thing you want to do is clean the area. So you'll take the Easy Kill towelettes. Take one towelette and clean off the table. Take the hyfricator tip, start from the top, and then work your way down. At the same time, just clean the base of the hyfricator as well. The next thing you'll do is take the non-fenestrated drape, and you'll see the difference. So right here, I'll say non-fenestrated drape. You'll open the non-fenestrated drape. And then you'll grab the corner of the non-fenestrated drape. It's okay just to touch the edges. Drape it over the surgical tray. Then open the fenestrated drape. And then dump the fenestrated drape onto the surgical tray without touching the sterile tray. This whole area is sterile at this time. Next, you'll open the surgical tip by pulling back the plastic side and then gently pouring it onto the surgical field. Once again, do not allow the outside of the McKesson sterilization pouch to touch the sterile drape. You'll also put a 15 blade marked right here under the surgical tray. You'll ask the physician which sutures he or she would like to do use during the procedure. For the backs, we end up using a larger suture. The larger sutures are designated by the smaller number, so this is a 3-0, and the needle size for this is FS2, and this is an image of what the needle size is. Generally, the larger sutures designated with the smaller number have larger needles. You peel the two sides of the suture and you let the suture fall onto the tray. Vicryl is used for deep sutures. For superficial sutures, we're going to be using 6-0 fast absorbing gut. This you peel and it will stay in its case on the tray. In preparation, you'll open one bottle and just leave that on the tray. As you go, you want to just clean up the area as well, your countertop. You'll open one pair of gloves and then just leave one side of the gloves as an area, as a staging area for the gauze to clean the area for preparation. We use the chlorhexidine solution and 2 or 3 pieces of gauze in 3 different groups to clean the field prior to surgery. Do not use chlorhexidine in sensitive areas around the eyes and ears, as they can be toxic to those areas. In those areas, you'll use iodine. In addition, you want to have the appropriate amount of lidocaine. It's always good to have 2 5cc syringes and a couple 3cc syringes. Here's a 3cc syringe, and we'll grab a couple of the 5cc syringes as well. Make sure not to open these things until you're absolutely certain that you'll be doing the surgical procedure. The last thing you want to do is put the hyfricator tip on the tray. It's a double sleeve, so you'll turn the hyfricator tip to the side, you'll push this to the end, grab the little white collar, and peel both sides off. Once again, making sure not to touch the sterile part of the hyfricator and just have it resting on the side of the sterile tray. So that completes the preparation for the surgical tray. If there is some time, you may want to prepare some of the hypofix. The Hypafix is used to put on the pressure bandage. Generally about a 3-inch piece of Hypafix is used, but you can also have a couple 1-inch Hypafix pieces as well to just have out in preparation. This can also be done after the surgical procedure is completed. That concludes this module on preparing for a surgical procedure.